Hi, everybody. Welcome. Dr. Waters with Platte River Foot and Ankle Surgeons, and I'm here with our awesome patients again. So excited to have these guys down here. Thanks for coming down. This is Drake and his mom, and we're here to talk about a super common problem in the foot and ankle world, and that's ingrown toenails. So just a brief introduction, if anybody doesn't know what ingrown toenail, I think most people do know, but it's where the usually on your big toe, the nail on the side of the toe cuts into the skin, and that can often result in an infection and a lot of pain typically for patients. And so we're here with somebody who has experience, firsthand experience. I do, but somebody else does as well with ingrown toenails, and excited to have them here. So thanks for coming down, guys.
Yes, thanks for having us.
Good. Let's start at the very beginning before the ingrown toenail and just talk about, how did you find our practice for ingrown toenail? What was that process like for you guys?
We went to his regular doctor, and she kind of looked at it and seen it was just a little too severe. And so then she referred us to you guys.
Good. Primary physician sent you over to our office. Yep. So we appreciate them doing that. So tell us, Drake or Mom, what was it like for you? Like, what kind of symptoms were you experiencing?
I really didn't feel it until when I tripped. The front of my foot hit the top of the front of my shoe. So then I felt how my nail was.
Yeah, was it painful when that happened?
Yeah.
Yeah, super painful. Usually any kind of bumping, anything like that causes it to be really painful. So
it was not good.
What did you see when you saw it?
It just looked like his toenail was infected. So I figured we'd just get some antibiotics. Sure. And it was farther deep down there.
Yeah. So, I mean, typically that's what, they get red and inflamed, and commonly we treat them with antibiotics. But the real secret is you can't get rid of the infection unless you remove the nail that's cutting into the skin. And so that's usually where I get involved, as opposed to like a primary care physician who would just give you antibiotics for this, is the removal of that portion of the nail. So from Drake's perspective, you want to tell him what's involved in the procedure to get rid of the nail? Was it scary?
Yes.
Yeah, okay. It usually is scary when people hear about it, but can you tell everybody what was involved? Like, what did we do?
Do you remember?
They had to numb my toe.
Correct.
And when they were numbing it, the syringes really hurt. The shots really hurt.
Correct. No, it does. That's the worst part of the whole procedure for sure. We have to numb the toe up so we can cut the nail all the way back to where the problem is. And so that's always the worst part. So
when it's done being numbed after the thing, it feels really weird.
Yeah.
And
But did you have any pain once we were done numbing it after the shots and everything? No pain, right? No ingrown, no pain.
It was just a weird regrowth process.
So he's right. I think some patients are worried what it might look like. You won't be able to tell that we had removed this side of the nail. The skin comes right up to the side, kind of like what Drake was saying. And so there's can't really tell. If somebody's worried about wearing flip-flops after this procedure, you don't have to worry about those kinds of things. And the beautiful thing is I've actually had this procedure done to myself. No pain usually afterwards, no swelling. Did you have a lot of pain, Mom, that you remember after the procedure?
No, not really.
Right. Yeah, it's nothing that ibuprofen can't handle. It's something that we do right here in the office, right, Drake?
Mm-hmm.
But the beautiful thing is if you have babies, and I've had babies who have had this, we can take them to the surgery center where they can get a little bit of sedation. So if you have those real little ones that aren't going to understand that we got to numb up their toe, that's another option for us as well. So after the shot, then we clip the nail out. Pretty easy after that, right?
Yeah, it looked weird because they had this stick and some weird liquid, and it was getting pushed up my toe.
Correct. And that's so the nail, just the side of that nail won't grow back. So he doesn't keep having this problem, keep coming in and keep having to have shots and stuff. So, Mom, what do you remember about the aftercare? Was it hard? Was it difficult to take care of?
It was pretty easy, especially with the kit that we purchased when we left. It was pretty easy it wasn't that hard.
No, didn't. So, and the aftercare is simple, like she said. It's just a little bit of wound wash to clear the drainage out of there, and a couple days of a dressing, and that's about it. So, Pretty simple, super common. I know there's probably 50 people walking around with ingrown toenails out there right now at any given time. So if you have any questions, hopefully this answers some of those questions. We take care of these in the office. We can get you in same day or next day to take care of them. Appreciate you guys coming down. Did you guys have a good experience with the
Yeah.
office? and
Oh,
everything?
yes, yes.
Staff was good, everything good.
It was amazing.
First class experience, come down, we'll give you 5-star treatment. We'll take care of those ingrown toenails for you. If you have any questions, give us a call. Look us up on social media, on Google, whatever you want to do. Thank you. Have a nice day.